Dr. Kevin Kavanagh, bless his heart. I mean, he is a busy guy, but he has switched around with us now to accommodate the governor. Governor Andy Beshear will join us about 9:45, and we've got Dr. Kavanagh now. Good morning.
Good morning, sir.
Tell us about what you did on Wednesday and what you learned and how that conference went.
Well, it went really well. We had literally hundreds of people signed on from around the world, and it had to do with policy and what has happened in various countries regarding COVID-19. And we had notable infectious disease authorities from Singapore, the Netherlands, and Spain, along with, well, maybe not so much me from the United States, but I was in the mix too. And they talked about what happened. Now, some of these lectures are already up on healthconference.org. So if you want to see the presentations, don't take my word for it. You can go there and listen to them. And one of the overall themes is that initially, especially in Europe, they were caught off guard with this. A lot of the missteps that people complain about the CDC, all of the infectious disease people were doing similar missteps in Italy, Spain, etc. They really underestimated this virus, and it may have been because the virus mutated and became more infectious in Europe. Who knows? But the virus was underestimated, and as the infectious disease and public health officials learned more about the virus, they changed their guidance. And this is where things went awry. In Europe, they went along with the guidance, and they said, yes, we're going to follow it. And if we have to wear masks, we'll wear masks. If we have to social distance and close, we'll do that. And they had 90% or plus compliance with the people. And that's different than what we have here, because here, when this happened, a false narrative started to develop. Well, science doesn't know what it's doing. We're not going to pay attention to them. Therefore, we're not going to follow any of these recommendations. It's just political. Well, these are the same recommendations now that are throughout the world. It's not just political. So that's at healthconference.org. Very good site. Log on, take a look at it. And we also have a description from myself, which will probably get me into lots of comments and trouble, of how we got to where we are.
Okay.
And that's simply an opinionated commentary, and I say that up in the beginning.
Are you? That's in there too. How did you handle the different languages?
Well, they could speak English quite well. That's one of the things. One was the past president of the Large Infectious Disease Society in Europe. He was the immediate past president. We had another one who was the editor of the Journal of Antimicrobial Resistance and Infection Control. So they were really prominent people, did a lot of international speaking, and their English is quite good. I must admit, though, that on the videos I posted, I did a little bit of sound editing, but not much. They were right on target. Probably better than my English. You would be surprised. Some of the foreigners who study English talk about verbs and prepositions and all this stuff, and I have no idea what they're talking about. I just go out there and talk. So,
well, that's wonderful. I'm glad it was successful for you. Holly made a great point this morning earlier, and she's with me now. Holly, you said, paraphrasing here, there is so much resentment toward the wearing of the masks. That's going to be a big subject coming up with the governor here in a few minutes because of that Boone County judge. We'll find out if he has actually signed the temporary injunction. But what you said, Holly, as I'm paraphrasing, is if, say, we wear the masks and we find out later that they didn't do any good, what have they hurt? Right?
Yeah.
Yeah, that's true. I largely agree with that. There's a very, very small number of people who can't tolerate a surgical mask, and they're exempt. But I can tell you, we wore these in medicine, in surgery, all day. It was never an issue. In my whole career, in multiple institutions, multiple states, never an issue. And if your lung function is not good enough to wear a mask, you're so high risk for COVID and its sequela, you should not be out in public anyways. I mean, that's just the bottom line. And I just don't understand this as a political issue, because right now the National Retail Federation is asking for a nationwide mask mandate or policy so that they can enforce it uniformly across their stores and not have angry customers. Certainly the healthcare sector has been asking for this. And I can tell you, back in the 1990s, I couldn't find a healthcare person who wasn't supportive of the Republican Party in many issues. But I'll tell you, what's going on now, this issue is losing a lot of the healthcare industry support. And certainly the retailers, I think that's the same. I do think the Retail Association is not very hot on closings, but they are very much supportive of doing things safely, both for their staff and for other customers. And that's key to getting our economy going again.
Well, you're a gentleman and a scholar for changing around with us this morning. And we will talk to you on Monday morning. And thank you so much, Dr. Kevin Kavanagh. I'm glad that the conference went well.
Thank you, Jack.
And stay with us because we will take our break and then we will return with Kentucky Governor Andy Beshear.